Again, my name is Jeremy Hanson Willis. I use he, him pronouns, and I'm the CEO of Rainbow Health. Rainbow Health was born out of the LGBTQ community's response to the AIDS epidemic in 1983. And for 40 years, we have been working to fight for health equity by responding to the health needs of gay, lesbian, bisexual, transgender, queer, and others in our community, and those affected by HIV and AIDS, with a wide array of services, mental health services, social services, and other community health supports to make sure that our community thrives and stays healthy. So I'm here today on behalf of the employees of Rainbow Health and the hundreds of transgender, non-binary, queer, gendered, and other folks in our community to say thank you to the mayor and to the council president and other leaders who are standing up for our community today. As has been noted, what we're talking about is a matter of life and death. Gender-affirming care is life-saving care. And access to this care denied is like life denied. The rising number of shameless attacks around the country on transgender people and other gender non-conforming folks causes real harm. And through our work, we see firsthand the harm that these anti-transgender attacks have, whether they come from far away or nearby. We see it play out in the transgender folks we serve, but also in our data. In our studies, the 2020 Voices of Health survey of more than 2,800 Minnesotans found that 46%, almost half of trans non-binary Minnesotans, face anxiety or feel on the edge on an almost daily basis. 36% say they're depressed on a daily basis. And 33%, more than a third of trans non-binary Minnesotans, feel hopeless on a daily basis. And we know that in a nation gripped by racism, that anti-trans policies are not applied equally, but with greater force and impact falling on those who are also Black, Indigenous, and people of color. But these persistent attacks on the transgender community and people are exactly why we're here today, and why we continue to fight for health justice for all, so that all queer people across Minnesota and across this country can go to any clinic, any hospital, any treatment center, and get the quality, life-affirming, gender-affirming care that they need and afford. Every single person. So this executive action is very important because it will strengthen families in Minnesota and in Minneapolis. And it will tell transgender folks that this is a place and these are people who care about them, who will help keep them safe, and are there to protect their health. Minneapolis and Minnesota have had a long legacy of leadership on protecting transgender people from discrimination, and today this action to protect access to gender-affirming and life-affirming care is another step in that legacy. Mayor Frey, thank you for being part of that legacy, and to all of my colleagues and partners in the community, thank you as well.